I recently had the opportunity to sit down and chat with Kiera from the Birth Advocacy Podcast, and it was such a fun conversation because we did not just talk birth, we did not just talk breastfeeding, we talked everything. And through our conversation, we found out that we had the same midwife present at our birth. How crazy is that? Because we live states away from each other now. This was such a fun conversation, and I hope that you enjoy listening and learning how you can advocate for yourself during pregnancy, birth, and postpartum. Before we get started, I did want to remind you that right now you can go book a breastfeeding clarity call where you will get your breastfeeding questions answered. If you have a few breastfeeding questions, but you're not sure if you need a full consult, you don't really know if you even need a lactation consultant, you don't really know what to do next, or you don't know where to turn, something's off, but you're not really sure what it is, or you just really want to breastfeed and you're really worried it's not going to go well, Breastfeeding Clarity Call is for you. Go ahead and click the link in the show notes to set up your appointment now. Hey, Mama Bear. Welcome to the Breastfeeding with Confidence podcast. Do you dream of bonding with your baby through exclusive breastfeeding, but worry about breastfeeding pain or low milk supply? Maybe you're struggling with breastfeeding and no one seems to have any answers. I'm Jaimie, doula, international board certified lactation consultant, and mom of 5, and I have been where you are. After working through painful latches, milk supply worries, and postpartum depression, and supporting countless mothers through their breastfeeding journeys for over 8 years, I'm here to tell you breastfeeding doesn't have to be perfect to be positive. Each week, I'll share breastfeeding tips to help you prevent and overcome unexpected breastfeeding challenges so you can actually enjoy bonding with your baby. If you are ready to shut out the toxic whispers of the world, embrace your God-given intuition, and release your inner fierce mama bear, grab some coffee or your favorite herbal tea and let's dive in.
So I guess I want to start by asking how you got into lactation. I see you're a nurse and a doula and a lactation consultant. How did you get into all of it?
Yeah, no, that's a great question. So when my son was born 10 years ago, I was convinced that, I'm a nurse. I read a few books. I read some blogs, like, I got this. And if it doesn't go exactly how I hoped, the nurses and doctors, they're all pro breastfeeding. Like, they're going to help me.
Yeah.
And that was way far from the truth. I ended up he flipped breech, like, at 39 weeks. They refused to flip him, scheduled me for a C-section 2 days later. Like, everything just went wrong. And then breastfeeding got off to a terrible start and nobody would help me. They told me I'm just a sensitive redhead and that's why I was in pain, that there was nothing wrong. And that was the ongoing story.
Stop
I know.
it.
I like, everybody says that when I say that. I'm like, I cannot believe I'm saying this. Like, I am being 100% truthful. Like, I still to this day am like, I can't believe she said that.
Oh my God.
That was the IBCLC at the pediatrician's office who said that. And then the pediatrician was like, well, the IBCLC says there's no problem. You're just sensitive. So you should probably just quit. And I'm like, thanks. No, that's not what I asked for. I asked for help. So,
oh my God. So hold on. Were you a labor and delivery nurse at the time?
No, I wasn't. I was actually, so I'm an LPN and this is actually part of the story later, but I was getting ready to start a bridge program when my son was like 6 months old. So I had been working toward that because I wanted to go into labor and delivery. That had always been like, that's where I did best in my clinicals. Like that's always been my jam. I needed to be an RN to do that. So I was working toward that. So my son was about 5 weeks old. And my husband, he's in the Air Force, and they had a plane crash. So he had to like up and go. And I'm like in the midst of postpartum depression, can't feed my baby. And my husband just is like abandoning me. So he called my mom, who lived 8 hours away, and was like, you need to come stay with her or she's like they're not going to be here when I come back. And so she came down to help, and she was basically like she saw for the first time how bad it really was. Yeah. And she was like, why isn't anybody helping you? Like there's a problem here. And I'm like, I know there's a problem. Like this is what they're telling me. We lived in a very, very small town in South Carolina. So it was like 2 resources. They sucked. And so then it's just, what do you do? Right.
Yeah.
But I'm really stubborn, but I didn't know what to do next. And my mom was like, well, our friends back home had similar issues, and who did they see? Because they got past it. And I was like, well, yeah, back at home, there's this person, that person, blah, 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 blah. And she's like, well, why aren't we going there? And I was like, oh, I can do that. She's like, yes, you can do that. Like, you're in charge.
I love it.
Phone call, pack the bags, get in the car. So we drove 8 hours, found out my baby had a tongue tie, lip tie, the works, like got it released. He started breastfeeding amazingly. Like, we got past it. I go back and I tell the pediatrician and he's like, oh, cool.
What the hell?
Yeah. So I was like, whatever. Like, I got breastfeeding down to a great start. Went to go start that bridge program for the RN. And my baby is like 5-6 months old now. And I'm like, I've worked so hard to breastfeed. I'm not quitting for school. Like, I'm going to make pumping and school work. And I asked the nurse director, I was like, all right, so what's the pumping accommodations for clinicals and lab days? And she laughed in my face and was like, you don't have any protections. And I'm like, so you're going to teach me breast is best. God.
Yeah.
And that's what I have to answer on the test, but you're not going to accommodate that. I walked. I was like, done. I'm going to figure out how to support moms without being part of this system. And so then I started down the path of being a doula and lactation consultant.
Oh, that's so fucked. Oh my God, I can't. That is insane. So you said this was 10 years ago?
This was 10 years ago.
Dang. I mean, a lot has changed, but like the system still has a lot of growth to do, but like, damn. That is crazy.
I know. If I wasn't so freaking stubborn, I would have just been another statistic of like, okay, like, I guess I just failed. I'm not meant for this.
Yeah, it's always pushed on the moms, always.
Exactly. And there's so much guilt for moms in that. And it's thrust upon them. They feel so broken. And I'm like, I just want moms to know, like, you are not broken. Just because things are hard doesn't mean you're broken. It doesn't mean you have to quit. And I always say, because breastfeeding isn't perfect doesn't mean it can't be positive. And you probably feel the same way about birth. Like, just because your birth plan doesn't go perfect doesn't mean it can't be a beautiful experience and you can't still have like an amazing postpartum. But it's hard and you need that support.
Exactly. So let's rewind a little bit to your birth because I'm curious. So 10 years ago, I mean, did you have a doula at your birth? Did you have a birth plan? Like, what did it look like for you going into your birth experience and then having it completely like flipped on its head?
Yeah, I hired a doula like around 34 weeks. She convinced me, I say convinced me, that sounds bad. She like informed me I could switch providers because I didn't like my providers. And again, there were only 2 practices in town. Well, come to find out, one had like horrible C-section rates and refused to attend VBAC. Same hospital. They practiced at the same hospital. The other one had midwives on staff, like lower C-section rates, and they did VBAC. So at 34 weeks, I switched providers to the midwifery practice, and everything like was going well. And then the rug got pulled out from under me still, and they didn't let my doula be like there at all. She wasn't allowed in the OR. She wasn't allowed in recovery. My parents were in the like prep room with me, but after the surgery, my son was taken to the nursery NICU thing because they said he wasn't breathing well. Like, that's a whole other saga we could spend a whole bunch of time on. And so of course my husband went with him. Well, I go into recovery and my mom walked in and the nurse basically yelled at her, told her she's not allowed to be in there. The only people allowed in there are the baby and the baby's father. And so they didn't let my doula in. They didn't let my mom in. I'm in recovery, like crying my eyes out, puking my guts out, and bleeding out. And they're just like, no, you're not allowed to have support.
So are you in South Carolina now?
No. So we moved to New Jersey and then Texas. And so we're in Texas now. But I ended up having a VBAC with that same practice that I had my C-section with. I had a VBAC, same OBs, like different midwives.
Amazing.
It was amazing. All statistics and odds were stacked against me. I should not have ended up having that VBAC based off how broken the system is. And I did. I think at the time it was an 8% success rate in South Carolina for VBAC. And I was one of the 8%. So I felt like a total badass. 36 hours of labor, like the works.
Obviously, my jam and my passion is birth advocacy. So you obviously advocated your ass off for that VBAC. But how did that birth experience look different than your first? Like, what did you do differently to prepare for your second that you maybe didn't do for your first?
I would say the biggest difference was I started chiropractic early. Like, I kept my hips loosey-goosey. This is actually really funny. My son was breech at 34 weeks, and I was getting really, panicked. And
here we go again.
Yeah. I went on a motorcycle ride with my husband where I had to be like hunched over to hold on to him. So my body was like in this really weird hunched position because I've got this giant belly. The combination of that and the vibration of the motorcycle flipped my son. I kid you not. We got on the bike and my belly's like high and he's
That is
breech.
insane.
We're riding and I was like, what was that? We got off and he was low and vertex. He was in the pelvis and stayed in the pelvis until he was born.
That is wild.
I thought so too.
I have never heard a story like that.
With like all my subsequent pregnancies, my husband would be like insisting on taking me for a ride, like toward like in my third trimester, and people think that's crazy. But the vibration on my hips like relaxes my hips so much. It makes sense. It's like shaking the apple tree, like it's that relaxation.
Yeah, I was just gonna say it's like Rebozo, yeah.
Yeah, it's like that relaxation just allowed, I guess. And then just, I think it was also like that weird, like hunched over position. Like he had nowhere to go when that shaking was on. My husband, like whenever I was on call for somebody and they kept like going, like having, like intermittent labor, whatever, like early labor is like not really kicking off. He's like, do you want me to take them for a motorcycle ride? I'm like, I don't think other people are going to get on with.
He starts a business. He's like, come flip your baby. Oh my God, that is hilarious.
Like right before labor.
Oh my God.
Like my fourth, we went for a motorcycle ride into labor the next morning. Like it's like our thing. It's kind of funny, and people are like, "You're insane getting on a motorcycle."
Pregnant. That is. I was gonna say that's like your
maybe, but
that's like your thing now.
Yeah.
That is so funny. I've never heard that one before. It makes sense though. Like the vibration and the position makes sense.
Yeah, it's once you think about it, you're like, oh, like okay, that actually isn't so weird, but it's crazy. The funny thing is,
it adds up.
I always was like, is it like ridiculous for me to get on a motorcycle pregnant? Like, am I being completely insane doing that? Because it's like in European countries, motorcycles are some families' only mode of transportation. That's why I was like, okay, so maybe it's not that bad. Like,
you're like, we're not that crazy. I mean, it clearly works. So
yeah. So maybe it
clearly works. That's so funny. Have you had all VBACs then since your first?
Yeah. Yep. I had a hospital VBAC with epidural, the works, and then I had 2 home birth VBACs and 1 birth center.
I love it. I had my daughter at home too, and there's just nothing like it.
It's not. It's honestly the best thing in the world. What about you? Like, what got you into birth advocacy?
Totally is. Yeah. So kind of COVID, actually. I found out I was pregnant 3 days before the world shut down for COVID. I was living in New Jersey. I know you said you lived in New Jersey at one point, so I'm sure you're aware of how it is there. But Jersey lost their damn mind during COVID, and birth was going to be crazy. We found out we weren't going to be able to tour the hospital. They wanted me to labor in a mask. Chris, my husband, wasn't going to be able to. We were in Trenton, right outside of Trenton, like near Princeton.
Okay, I was in Pemberton. It's like
that sounds familiar.
Yeah,
okay,
like it's not far. Like I was actually seeing midwives in Trenton.
Crazy.
Yeah.
Were you? Okay.
Yeah.
So we went down the whole path of, again, I was always like, get me to the hospital, get me the epidural. And then I got pregnant and was like, wait a second, I kind of want to look into this. But then again, like COVID hit 3 days after I found out I was pregnant. We weren't going to be able to tour the hospital. I was going to have to labor alone in a mask. And I was like, that's a hard no for me. And they said that if me or my daughter showed any signs of COVID, we'd have to be separated for 14 days. And I was like, hard pass, I'm breastfeeding. Yeah, Jersey lost their damn mind. So I was like, deuces, that's not for me. I had some friends who had home births, and I was always like, y'all are nuts. Like, what the hell? That sounds crazy. But because I think so. It was the one that was off the highway that I can't remember. Was it 95? 95 that turns, I think it was Capital.
Oh my gosh, because
I'll have to look it up and send it to you.
I was going to a lot of births in Virtua, and they were surprisingly not that bad during COVID. I was surprised. Like I expected it to be worse. So
wherever this was,
so upsetting.
Yeah, this hospital was like 5 minutes from our house. So I was like, oh, perfect. But then all this shit went down, and I was like, yeah, no, that's a no for me. So I started talking to all my friends who I thought were crazy for having their babies at home, and I was like, this actually sounds pretty cool. I obviously watched The Business of Being Born. That's kind of like the gateway drug to it all. Started reading a ton of books. My husband and I took a Bradley birth class that was like 12 weeks long. And we were like, guess we're having this baby at home. I guess we're doing like business of being born was like the one thing that really opened my husband's eyes to like, wow, this is actually insane. Yeah.
Yes.
It's like the gateway drug to home birth. So yeah, we quickly changed plans. I was at a midwifery practice, but they were CNM. So they were midwifery practice at the hospital. And then I stayed with them, I think until my anatomy scan. That way I could bill everything through insurance. And then I switched over to a home birth midwife and obviously did all my prenatal care at home from the comfort of my couch, which was amazing. Now that I'm getting into surrogacy and I have to birth in the hospital, I'm like, I am going to miss that so much.
Is it okay if I ask you who your midwife was?
Yeah, shut up!
Yeah.
No way!
Yeah.
Oh my God, that is crazy. Yeah, they're amazing.
Yeah. Yeah.
What are the fucking chances of that?
That's crazy. No, she is amazing.
Oh my God.
Fantastic.
That is wild.
Yeah. Oh, that's awesome.
So here I am in South Carolina, you're in Texas, and we had the same midwife at our births. Yeah, that's why I was asking you. What the hell?
My God.
That is insane that we both had the same midwife at our home births. That's wild to me.
Yeah, no,
what are the chances?
And now you live in South Carolina. Like, we're in South Carolina.
And now I'm in Charleston.
Okay, we were in Sumter, so like middle of the state, not quite Columbia. Yeah.
So insane. So we were both in New Jersey. We were both in South Carolina. I've not lived in Texas.
Well,
what are the fucking chances? That is so funny. So crazy. But yeah, that's kind of how I got into birth is COVID, honestly. If COVID hadn't have happened, so backing up a little bit, my daughter was asynclitic with a nuchal hand. So labor was start and stop, prodromal labor, 72 hours of labor. If I was at the hospital, like if COVID hadn't have forced me into a home birth and I was at the hospital, I would have been a C-section on day one, like hands down, no doubt about it. And so thank God, that is like the only positive thing for me that came out of COVID was like forced me into home birth, forced me into learning everything about birth. And then obviously I had an incredible home birth. It was long as hell, but forced me into birth. And I wanted to like literally learn everything about birth after that. So I got my doula certification. Well, I started my doula certification at 4 months postpartum and here we are.
Yeah, I love that.
It's crazy.
So let me, I guess, ask
insane.
you, with your birth advocacy and advocating for birth, I mean, you and I both know that how your birth goes directly impacts breastfeeding. So from the doula perspective, like how do you see like that learning the advocacy in birth? How do you see that translating to having a better breastfeeding experience maybe, or knowing how to get help?
Yeah, I think it directly correlates. I mean, I see just from my practice, I see moms that do not get an epidural breastfeed a lot sooner than moms that do. I see moms that have a vaginal birth breastfeed a lot sooner and easier than moms who have a C-section. That's not to say moms that have an epidural or a C-section can't breastfeed. It just happens a lot easier. I see from my experience, from what I've witnessed in my practice, so much easier when you don't have the epidural and you don't have a C-section. Again, like if you have those interventions, you just need to be able to advocate for yourself a little bit easier or a little bit more, I should say.
No, I agree,
but there is definitely a correlation for that.
I agree with you. And I tell people, I'm like, I'm not going to tell you that interventions are bad or wrong because there's a time and place for everything. I have my personal preferences, but I have had of course. Like, I get it. There's a time and place for everything. But, you know, if you, for instance, are having a really hard time latching your baby, you feel super engorged and your baby loses a whole bunch of weight in the first 24 hours, instead of thinking, I'm broken, my baby's broken, they're not getting enough milk, you need to think, how many bags of fluid did I get? That's why this is happening.
I was just going to say that.
So it's about
I was just going to say that.
Yeah.
They don't. Yep. They don't share about the bags of like the IV fluids and how that's going to inflate baby's weight. And then they're like, baby's losing all this weight. And it's like, well, no shit. You've just given mom how many bags of IV fluids?
You're also so engorged. It makes it harder for baby to latch. Like, so it's a double-edged sword here, right? And so many moms are led to think, okay, this means I'm not going to be able to breastfeed. I'm not making enough milk. I need to start formula. My baby can't open their mouth wide enough to latch. And that's not the problem. So if you can just understand the connections, then you can say like, well, let's slow down here. Like, this isn't because we're broken. It's because we had these interventions. And we know that. So let's not overreact.
Yep. Yeah, and I think a disconnect that moms make is they might be okay asking for more time during birth, right? So if an intervention is thrown their way and they are ready to advocate for themselves, oftentimes they're comfortable saying, hey, can we have 5 minutes? Like, let's pump the brakes, let's slow down. But I do see they have a harder time doing that with breastfeeding. So if a nurse is there and they're getting overwhelmed and, you feel the blood rush to your head, you're getting really hot, they have a hard time in that moment saying, hold on, like, can we stop for a second? And I think we have to continue that advocacy into breastfeeding. It's natural, but it doesn't come easily. And so that advocacy doesn't stop the second baby comes out of your body. That advocacy needs to continue into breastfeeding and into postpartum as well.
And that's what I tell moms. I'm like, it's not about having the perfect birth. It's not about having the perfect breastfeeding experience. It's about learning how to advocate, because when your baby is not a baby anymore, you're still going to have to advocate. You are constantly having to advocate for your child. I remember my son was 2 years old. He broke his leg. We got rushed to shock trauma, basically. Like, they thought they might have to do surgery. It was awful. And it was at the beginning of COVID. It was literally right before they stopped allowing people to come support. So my husband was able to come visit while we were inpatient, which was great. But it was right after that they stopped. But it was,
that's crazy.
I promise you this is relevant. We were in shock trauma, and I got in an argument with all of the doctors because they wanted to give him Versed and fentanyl, both, to set his leg. Or not Versed,
oh my God.
Ketamine. I'm sorry. It was ketamine and fentanyl they wanted to give him to set his leg. And he was
Excuse me, he's 2?
He's 2. And I was like,
hard pass.
I'm not okay with this. Like, that is too much. We can do the ketamine. He's wailing. We can do the ketamine. We're not doing ketamine and fentanyl. No. And they're like, oh, well, don't you know?
That's nuts.
Well, actually, I'm sorry. It started before that because we went to one hospital and got transferred to another, and they wouldn't transfer without an IV. And I was like, he was fighting the IV. I was like, he's stable. Why do we need an IV? Ugh. And they said, in case we need to give pain medication on the ride. I said, what are you going to be giving him IV? Because I knew what they were going to say. And the EMT looked me in the face and went, fentanyl? And I said, over my dead fucking body, are you giving my 2-year-old fentanyl on an ambulance?
That's crazy.
I said, he's in pain, and that sucks. Be in pain than you giving him fentanyl and going into respiratory distress. We're not playing that game. And he was
that's
stunned.
Nuts.
And they were like, fine, whatever. So we transferred, it was whatever. We get to shock trauma, same conversation. I had 3 different doctors. One got in my face like this, and she goes, it's not like the fentanyl you hear about on Facebook, right? And I almost lost it.
It quite literally is, actually.
I was like, I'm not doing this with you. You can give him ketamine. We're not doing fentanyl. They're like, well, blah, blah, blah. I was like, okay, fine. Let's have the conversation. Tell me the risks of fentanyl. Tell me what the risks are. And they're like, there's almost no risk. And I'm like, you are lying to your teeth. They send another doctor in. And then
they don't know.
One of them, so I grew up in Maryland, and one of them came in, and his keychain said University of Maryland shock trauma on it. And I was like, great. I know I trust you because I trust anybody who works in shock trauma at University of Maryland. I had a lot of friends who worked there and stuff, but I was like, we're from the same area. We're going to connect on that. Yeah. And so that's I saw that. And that's the first thing before he started talking, I was like, you're from Maryland. And he's like, yeah, how'd you know? I was like, I saw your keychain. And we started talking, and we connected. And then I was like, he was like, look, we really want to do this. And I was like, I understand. This is why I'm saying no. We're not doing it. Are you telling me you're not going to set his leg without fentanyl? Because that's pretty fucked up. And he was like, no, we're not telling you that. You're right. If you really don't want it, that's fine. And I was like, perfect.
Imagine that.
So imagine that. Exactly.
As easy as that.
This was the 3rd doctor. And it was so funny because you could see they were playing it. They sent in the super alpha, like male doctor. And then they sent in like a sweet woman doctor who was not very sweet. And then they sent this guy in who's like younger and cool. And I'm like, I'm not playing this game. After everything's said and done, the orthopedic doctor, who was not part of this conversation, but was the one who set the leg, came in, pulled me aside, and was like, I know everything that went down, and I just want you to know you did the right thing. I would have made the same choice for my child.
It's so crazy. Like, you did not have to explain yourself of why you were declining, and yet you're on this power struggle with these doctors. This is what I see in birth all the time. Well, I see it. It's literally an ego trip.
And that's the thing is, the whole reason I'm telling that story is, if I had not had to fight for my VBAC but like, there are so many things that I had fought for up to that point. If I had not done that, I would not have had the confidence to do it in that situation. And that would have been the first time I felt like, oh my God, what do I do? Like, I had already fought through so much, like, learned that doctors they don't always have your best interest at heart. Not to mean that they're intending to be evil, but it's about their protocols and what they're used to or whatever. And, I would have not been comfortable with being the difficult patient. But because I had learned how to advocate in birth and advocate postpartum and like for so many different challenging things, when it came to that, I was like, I always say, like, my fierce MamaBear came out, and she came to play, and she was not afraid. Like, afterward, everything settled down. I was validated by another professional. My husband was like, thank God you were the one there, because I would have been let him do whatever. Like,
it's so crazy. And it's so true. Like, it starts honestly in pregnancy. So I was talking with Alice Worthy. She's the modern doula on Instagram. And she made such a great point of like, you have to flex the muscle and work the muscle in pregnancy. And it starts by like, people saying, hey, is baby here yet? Like, setting that boundary and really advocating for yourself. Declining any tests in pregnancy that you're not comfortable with, like, really start flexing that muscle early, because once baby is here, like, honestly, you need it through birth. You need it tremendously through birth, but like, it doesn't stop when baby's here. Like, you still have to be able to advocate, like you're saying, like, well into 2. I mean, my daughter's 4.5 and I'm still advocating daily for her. You know what I mean? So
all the time.
It's definitely a muscle that needs to be worked and flexed, because it will make motherhood so much easier if you are comfortable advocating for your child. Like, everybody thinks that they'll have that fierce MamaBear, but like, if you're not practicing and doing it, it is so easy to crumble to the outside pressure.
It is. It's very easy to get into an authority complex with providers and like default to them. And I love my husband. I'm not trying to say he's like not great or whatever, but he's in the military. He's used to like having an authority structure, right? Like, that's very comfortable for him. So when my older son broke his arm 2 years ago now, I had just had a baby. I couldn't go with my son. Like, I couldn't leave the baby. I wasn't bringing the baby into an ER. Like, I had to send my husband, and I was very afraid, because I was like, I'm not there to advocate for him. My husband hasn't had that practice. He hasn't had the practice. It's not that he's not good at it. He hasn't had the practice of having to advocate in that situation. He did an amazing job. I was so proud of him. Like,
good job, husband.
He did so good. He would call me, and he would be like, I'm on the phone, and he's like, they're about to give him a medication. Like, what do I say? And he, like, the doctors are standing there. You can hear them. Like, he'd have me on video sometimes, and he's like, got it. And he's like, talk to her. Like, tell her what you're doing. He's like, you're not doing anything until she says it's okay.
I mean,
so
truthfully,
funny.
Sometimes it has to be, especially in the ER, right? Like, they just have protocols that they are expecting to follow, and it's the same exact way in birth. It's like, they don't know otherwise. Like, they are trained to follow this protocol, and it's like, you take one step out of the protocol and they're like, what do we do with our hands? Like, they're just completely lost. And that's why, I mean, as you know, having a doula during birth is so important to like, no, we're actually going to go this way, or no, we need to go that, like, and having that sounding board. So like, your husband calling you, like, you were almost like the doula in that moment, right? Like, I love that. But I mean, it really is. What I talk about a lot, and the moms that I work with, it's like letting go of that good girl mentality. Like, so many of us in my generation, I'm aging myself, so I'll be 37 this year. And there's something about our generation that's just like, we're expected to follow authority. You're expected to like sit down, shut up, and like be the good girl. Like, don't rock the boat. Don't be loud. Don't be like outspoken. But like, you have to challenge that in birth. And when it comes to, especially for breastfeeding, like, you cannot let that good girl mentality get in the way of doing the right thing. And what I like to say is like, speaking up for yourself, having confidence in birth and breastfeeding does not mean you have to be confrontational. Like, you don't have to go in there guns blazing, like totally this like opposition attitude. You just have to know the facts. You have to know like what you're speaking up for, and you have to really have that education beforehand, because if you go in there like just kind of going with the flow, like the flow is going to take you and you're going to get steamrolled. And so you have to let go of that good girl mentality. You're not a difficult patient for speaking up. You're not a difficult patient for saying, you know, hang on a second, that latch doesn't feel good. Or you have to speak up, whether it's birth, breastfeeding, postpartum. Like, you have to be
it's so
willing
true.
to use your voice.
Even with my my first VBAC, I was a very difficult patient. I would own that. Like, I was extremely difficult. I had passed the point that they wanted me to go. They were like, you know, they had their protocols, and I would come in there with the ACOG guidelines highlighted, and they'd be like, okay, well, most people don't know that, but since you do, like, we'll work with you. And I'm like, great, but also that's awful. Like, this is a problem. But after my son was born, and the OB, so she was a VBAC mom herself, so she understood why it was important. But they were like trying to talk me into coming in for an induction, like calling me, like, you haven't come in, like you've been skipping your appointments. Where are you? Is everything okay? And my husband was like, got on the phone with the midwife and was like, we'll call you when we need you. And
really,
we did. She was on call when I ended up going in. We called her. She was like, I'm so glad to hear from you. I'm so glad you're doing well. Like, come on in. But the rule was that the OB had to be in-house for the entire labor of a VBAC. So they could not go to the clinic. They could not, like, they had to stay in the hospital on the floor, couldn't go anywhere. And my OB was like, don't worry about it. Like, whenever you go into labor, call us. I'll come. She was there for 22 hours with me. She had every reason to try to get me to rush things along, and she never pressured me. And then toward the end, she did say, you know, like, you've been in labor like 33 hours. Like, you've been stuck at an 8 for quite a few, like, you've been working hard. A little bit of Pitocin is not the end of the world if you want it. And I was like, you know what? I do. Like, I am at that point where I know, like, I'm not going to last much longer. I've been awake for 36 hours.
I'm surprised they gave you Pitocin with a VBAC, with the risk of uterine rupture.
They started at, it's if you start low and slow, it's not risky.
Well, if you were already 8 centimeters, that would make sense.
Exactly.
Too.
And I was 8 centimeters. So it was like, it didn't go past the 4. Like, the baby was born 3 hours later. Good. Like, it was just the thing I needed. You know, it was like, it just pushed me over that edge that I was stuck on for some reason. And
and that's a really good point. Like,
pom-pom here.
See, my daughter was the same way. She had right up here, her fingers came out first.
My whole point was, I said, hey, I'm really sorry I was such a difficult patient. And she whipped around and said, don't you ever apologize for that again. You were not a difficult patient. You did what you needed to do. And that's okay. 100%. You're allowed to do that. And that, coming from a doctor, meant the world to me, because I thought we were not on the same team. I felt like we were not on the same team. And then I found out, like, we were on the same team the whole time. And sometimes I think we do get very, like, hyper aware of the risk of and the need to advocate, that we can almost create more boundaries than bringing that team together. So it's a balance. It's a balance that you have to find.
Yeah. And that's why I always say, like, don't go in there, like I said, guns blazing, like, ready to like fight the world. Like, doctors and OBs are not inherently evil people. Like, I think you said that before. Like, they are just trying to do their job. They do have, like, at the end of the day, like, I hate this, but like, their job is to make sure you and baby are both alive and walking out of the hospital. So like, they're going to do everything in their power to make that, but like, steps for them might get a little skewed along the way. For me and you and like anybody supporting birth, like, birth is so much more than that. And breastfeeding is so much more. Like, there's so much more than like just healthy baby, healthy mom. Like to me, again, that is the
alive. You mean
absolute
alive?
minimum.
Alive.
Yes,
Healthy,
exactly,
healthy,
exactly. Like
alive.
100%. It's they want to make sure you and baby are alive at the end of the day. And like, awesome, cool. Like me too, but like very bare minimum. And I was again talking on a previous episode about that. But like to me, that is the absolute bare. Like that is an assumption. To assume that a mom is also not worried about healthy baby, healthy mom. Like again, that is her only concern. So like to go in with that understanding is again, they're not inherently evil people. Like they are trying to do their job. They are trying to help you birth your baby. But you don't have to go in and like feel like you're fighting the world. And that's why it's so important, like I said, to flex that muscle throughout pregnancy too, because like you have to have that confidence of going and saying like, no, thank you, or I would like an extra 5 minutes to talk about it, or, you know, maybe Pitocin would be the best choice. Like there's no right or wrong answer in birth. It's just knowing the information and hopefully having a doula there to help guide you and, you know, help explain the situation and the options. But like, you don't have to go in there feeling like you have to fight the world. And I think a lot of moms are afraid to do that. And so they just don't advocate. So they're too afraid to be a difficult patient, quote unquote. And so they just don't really advocate for anything. Which, as you know, can impact birth and breastfeeding. So.
It does. And that's why, I have a breastfeeding resource library that is like amazing for pregnant and postpartum moms. But in there, I have a whole section. It's called Avoiding Formula in the Hospital. And it sounds so like, I'm trying to avoid formula or whatever. But it's completely designed around exactly that. It's like teaching moms how to go in and have the information so that they know what's happening, they know how to advocate, and they know like when this might actually be a reasonable option, like, or how to implement formula in a way that's not going to destroy breastfeeding, because you can do that too. You just have to be smart and cautious about it. And the sad thing is, again, it's the nurses and doctors, all they care about is a fed baby. They don't care about what the baby's being fed with. We have this idea that fed equals healthy, and that's not true. Like, it's emphatically not true. Like, that's not to say that fed isn't important. That's obviously the bare minimum. But we can't just say like, oh, like breastfeeding's nice if it works. Like, there's like actual scientific reasons that it is superior. And that doesn't mean it's the only option, but we need to do things in a way that supports health. And for some families, like the healthiest thing is supplementing a little bit, but in a smart way, not in a way that completely undermines any chance you have of breastfeeding. So I think that's important for moms to know too, is like, again, we keep repeating ourselves, but it's so important. Like, this starts in pregnancy, but you have to learn. You have to keep learning, and you don't know what you don't know. That's why when it comes to breastfeeding prep, you cannot be counting on this hospital birth class that was free to set you up for success. That it's not going to. They might teach you some bare basics that you need to, like, if you don't know anything about breastfeeding, but it's not going to teach you what to do when things go off the rails and you want to keep breastfeeding and you're getting bad advice. It's not going to teach you how to sniff out bad advice, how to recognize bad advice. And again, this does not mean that the nurses are bad or stupid. They don't have the training. They literally don't know. They are taught to make sure the baby is getting calories and pooping enough and peeing enough, and that's it. And so again, it just comes back to knowing how to advocate, and you can't advocate without information. I always say, like, 100%. Confidence in advocating for your baby comes from the place where information and intuition collide. Like, you have to have a healthy balance of both to make a decision you feel confident in. It doesn't mean you're going to have your unmedicated birth.
100%.
It doesn't mean you're going to exclusively breastfeed. It means you're going to make decisions that you feel comfortable with, that you're not sitting there saying, what if, should I, was this right, was this wrong? You're going to know it was the best decision for you at the time with the circumstances. It might not have been ideal. And 100%. That sucks. And we can grieve that, but we don't have to have this like soul splitting guilt over it when we have confidence in that decision making.
100%. Yeah. It's taking the information that you have and making the best choice. And a good birth experience, to me, I say this all the time, is I don't care if you get an epidural. I don't care if you get Pitocin. As long as you are the one making that decision, you are given true informed consent, not just here are the benefits. Like, also, what are the risks of that intervention, right? Like, you are given true informed consent and you make that decision. That is what equals a good birth experience. Again, it might not be what you were dreaming about. That sucks. That's awful. But were you educated enough and confident enough to advocate for yourself? That is what matters. And that is what's going to follow you into postpartum. It's like, were you in control? Were you the one making the decisions? Or do you feel like they were being made for you?
Yeah, I think a pretty good litmus test is the decision being made from fear and pressure because you're worried and scared? Or is it being made from just like, I don't want to be like too analytical, but like almost from an analytical perspective of like, I have this data set, this is what my heart is telling me. And this is a really hard decision, but I think this is the right path based on all these things. Like that is so much different than being like, they're making me feel like I'm a bad mom, my baby's gonna die, I need to do this, or blah, blah, blah. Like, if that's where you're making a decision from, you need to stop and turn to somebody for help and support.
And that is, I was going to say, that is why a doula is so critical in births. Like every single mom, regardless of your birth plan, needs to have a doula because like you said, if those decisions are being made out of fear and not with true informed consent, like that is where it all goes downhill. And so having a doula to kind of be that one that has that data, that knowledge, because again, when you're in labor, your brain is not in that sort of space, right? So having that doula to be the one who is that analytical one, who is the one with the data and the information to be like, hey, here's actually what they're saying. Like, do you understand? Are you okay with X, Y, or Z?
Yeah, no, I completely agree.
So how do you see, let's kind of transition into more of breastfeeding now, because we've kind of chatted a little bit about birth, but like, what do you see like immediately following birth, right? We're talking golden hour, breastfeeding, like ideally, what does that look like as an IBCLC for you? And where do you see it go wrong?
Yeah. I would say like ideally that looks like baby is immediately placed on mom's chest. They are not separated for any reason. Like I just did an episode on my podcast with Colette. I can't say her last name. She's from the Birth Lounge and she's a labor and delivery nurse.
I love her. Yes.
Yeah. I love Colette. And she was just talking about how like we talked about how you can even do resuscitation at the bedside. Like it's not 100% common in the United States, but as mothers and consumers, we need to start demanding it more because even resuscitation can be done at the bedside. There's literally no reason to separate baby from mom. Midwives know this well.
100%.
And so that's what ideal looks like. It's keeping baby with mom, unless there's like a really good reason. Like if mom needs like some type of resus or something, obviously, right? Like if mom asks for baby to be taken away because she just feels like she can't hold, like that, you're right. But ideally, baby is given to mom. Nobody's rushing the baby to latch. The baby is doing that instinctive breast crawl, finding their place, latching on their own terms. We're understanding the process that they're going to rest and then they're going to search around a little bit and then they're going to fall back asleep and that's normal and okay. Yes. And we just trust their instincts and then we work with their instincts. We work with their reflexes for that first latch. I see so many times, and I know you've seen this, baby's born, they're like, we need to get baby latched within the first hour because we're going to get over to postpartum and we're going to fit your bed up straight. We're going to put the baby in this cradle hold and you're going to hunch over, squeeze your breast and wait for the baby to cry when their mouth is wide open and shove it in and push their head up.
And they are so forceful with the latch. They're so forceful with the latch. Yes. When I see nurses grab the back of baby's head and they're like, all right, go, go, go. I'm like, oh my, I like actually cringe. Like it is so aggressive sometimes. I'm like, what is actually happening right now?
It is. It's awful. I mean, you know this, the baby's head has like receptor points on it. It responds to pressure to navigate the birth canal. So you're putting pressure on the baby's head. They're not going to go into the breast. They're going to turn away. They're going to fight. That is their instincts. So we have to understand their instincts and their reflexes and work with them. Having had home births and out of hospital births, I have had the freedom to find the position that works for me. I don't have a bed that sits up, so I was not immediately sat straight up. In fact, I would lay back. Instinctively, I would lay back. I'd roll to my side, and I'd do that first latch and sideline. And that's what moms really, quote, should. I don't like to say should, but if you want
I totally get you, though.
Like easy, slow, instinctual, like connected, relaxing experience, when they start to sit the head of that bed up, say, no, I want to lay back. Roll onto your side. If you feel like you can't roll onto your side, have somebody help you. Get onto your side. Snuggle with your baby in a cuddle curl. Let them explore the breast and help them latch in a sideline position. It's going to be 100 million times better.
Yeah, and you bring up such a good point, right? Like I talk all the time of like, moms will be in labor and they're like, well, what position do you think I should do next to try to get labor to progress? I'm like, what feels good? Like do what feels good. We have lost touch with our intuition. We've lost touch with our natural instincts of how to birth and how to breastfeed. We have to bring it back. Like it is so crucial. We have to start trusting our bodies again. And that has been stripped away from women for many years now. And you just bring up such a good point. Like what feels instinctual, what feels natural, do that.
Yeah.
And that is the same for birth and for breastfeeding.
So like we've been taught to ignore our intuition so much that if you ask somebody what feels natural, they don't know. What feels natural is what they've been trained, what they've seen. And the only things they've seen has been these really forceful approaches. And I always say, like, we need to get away from this control-based breastfeeding and go back to instinct-led breastfeeding. When we do that, we're going to work with the baby's reflexes. We're going to get the right extension on their chin. We can get a good deep latch. If we don't get that extension, we're not going to get that deep latch. You're going to start having pain and it's going to spiral.
Ultimately, at the end of the day, it comes down to prenatal education. So not just preparing for birth, but also preparing for postpartum. And that looks like setting up your bathroom with your postpartum pads and everything. But that also looks like learning about breastfeeding while you are pregnant.
Yes.
Like prenatal breastfeeding education, prenatal birth education, that is the key to bringing back your instincts, because you have to unlearn all of that bullshit before it's go time. Like you can't be like, oh, what did my class say? You have to have that going into it.
Be just like the run of the mill class. And that's where I think people think that they I think people think that they prepared and they didn't prepare adequately. I'll say, I always tell moms, you want to learn, like you don't want to learn how to swim while you're drowning. And if you wait to get breastfeeding help and learn the truth about breastfeeding until postpartum, when your baby's already here, it's the same thing as drowning and being like, can somebody teach me how to swim now? Like, no, you should have learned how to swim before. It's like, not to sound insensitive, it is 2025. We have the internet. There are so many resources. There's very little excuse to say like, I didn't know. Like we have to learn how to say, I didn't know, but I'm going to find out and try and just try. And then the last thing I'd like to leave everybody with is a lot of people like put breastfeeding on their birth plan like it's a box to be checked, but it like you need a whole separate breastfeeding plan. Like breastfeeding is not just like something you check off your birth plan box. Like you need a whole separate breastfeeding plan, and that starts like you can't even build that if you don't understand what you're dealing with from the start. And it comes back to that prenatal education.
Yeah, I think at the end of the day, right, like I preach advocacy, but in order to advocate, you have to have that education, and that all happens prenatally. And in that same breath, I don't think it all falls on mom too. So I guess like the last thing that I'd like to say to wrap it up is like, it also goes to dad, right? Partner, whoever is helping mom. It doesn't fall on just mom. Like mom should not be the only one taking the breastfeeding class. Mom should not be the only one taking the birth class. So while we talk about education, I just want to kind of lift weight off of mom's shoulders a little bit too. Like dad, partner, whoever is going to be helping you also needs to be learning about that. It's not just mom's responsibility.
No,
and I think a lot of times moms feel like it's their job to do. Yes, I know. We'll schedule part 2, but no, I mean, at the end of the day, right? Like if you're going to advocate successfully, you have to have that education. So utilizing doulas, utilizing IBCLCs prenatally is the key to having that successful birth and breastfeeding experience.
Yeah. Well, this was great. I loved this conversation. I
feel like we could talk all day, Jaimie.
We could. My iPad says differently.
All right, Mama Bear, that is a wrap for today. If this episode helped you feel a little more confident or a little more prepared for breastfeeding, can I ask you a quick favor? Go ahead and leave me a review. It helps other moms find this podcast and join us in this amazing community of fierce and confident Mama Bears. And hey, if you know a friend who could use some encouragement or real talk about pregnancy, breastfeeding, and all things motherhood, share this episode with her. You've got this, Mama Bear. Trust your instincts, stay fierce, and I'll catch you in the next episode.